Robert mentions that the interprofessional communication between all of his healthcare teams is sorely lacking, and because of this, his wife Linda is being forced to act as a middleman between all of the different healthcare teams. Consequently, this adds an unnecessary amount of additional stress to both Robert and his wife. Robert also mentions that no information is shared between the healthcare providers, which is causing Robert and his wife to repeat the same information over and over again, resulting in less time spent going over treatment options and plans for his Parkinson's.
It is recommended that Robert's healthcare team adopts an interdisciplinary team approach to ensure that Robert's goals are at the centre of his care, and also to decrease the burden on his wife Linda of having to communicate between the different health professionals. We recommend that the healthcare team sets common patient-centred goals with Robert, and that they communicate regularly to check in on each other's progress towards these. This can be in the form of regular online meetings and also emails to check in with each other's progress.
Another issue identified within the healthcare team in regards to Robert is the lack of using lay terms during his appointment, therefore leading to confusion and frustration with Robert and his wife when understanding his care plans across all interdisciplinary team members. The use of unfamiliar medical technology led to Robert and his wife not being able to easily answer questions during their appointment, ultimately restricting the therapeutic relationship between Robert and the healthcare team members.
To create better rapport and client understanding, Robert's healthcare team should engage in active listening, consistently checking in with the patient to make sure that he and any relatives understand what is being said. It should not be assumed that patients have any prior knowledge of healthcare words, and jargon should be kept to a minimum or explained simply. Healthcare team members should think about how they felt and what they knew prior to starting in the field. Finally, information should also be paced at a slow and steady rate so that the client is not overwhelmed.
Another area that demonstrated poor interprofessional functioning was the lack of role clarification. Robert appears to be unclear about the roles of each professional involved in his care, especially when there were almost 10 members in his care team. It was also noted by Robert that new players, such as the occupational therapist, came in to perform assessments without proper role introductions by himself or other professionals on his behalf. As a result, Robert and his wife were unsure of the purpose of these visits and what each professional was doing for them. This has made it very difficult for them to understand the situation and to foresee what will be happening for Robert during the session.
To improve role clarification for Robert and his wife, each health professional should introduce themselves and clearly state their role when meeting. This will help Robert understand what each profession does, since there are so many present. Additionally, providing a written summary or video about each healthcare profession would make this process feel clearer. This would help Robert feel more supported and informed, which is vital in the collaborative process involved in his care.